COVID vaccine now widely available to younger children. Trauma and emergency physician Dr. Kelly Victory is going to join us now with some things parents should consider before their child gets the jab. Dr. Victory, good to see you today.
Thanks for having me, Ginger.
Well, thanks for always lending us your insight. The FDA saying that, well, based on their clinical trials, that this is a safe vaccine. But have those trials stood up to the test of time?
Well, I don't think that this decision was surprising to anyone who's been paying attention, Ginger, but it doesn't make it any less disconcerting. The clinical trials, we must use that phrase loosely because the trials have been very, very limited. We have to remember that these vaccines didn't exist a year ago, and they didn't even start testing them on children until the end of May or early June of this year. Given that it's just the beginning of November, we've got somewhere in the range of possibly 4 months worth of data. And that simply isn't adequate in my mind to determine anything about the safety, let alone, or the efficacy, frankly, of these vaccines. I am quite pro-vaccine, but the vaccines that I routinely recommend, particularly for children, are those that have been through the rigorous testing to get fully FDA approved. And that frequently can take a decade or more. And typically those trials, true safety trials, take place on tens of thousands, if not more, children before they are ever concluded that they are safe. Polio and chickenpox, for example, were tested on more than 1 million children before they were released to the public. These COVID vaccines were tested somewhere in the range of 1,100 children, half of whom were in the placebo group. So we have really, really limited safety data, and I think it's quite concerning, particularly when weighed against the almost zero risk that children have from having significant illness from COVID itself.
Even with the adults getting the vaccine, we've already seen, well, first of all, the efficacy isn't as big as they thought it was. So now there's a booster, and there's already been so many adjustments for bodies that are not going through the same kind of changes as especially this age group, 5 to 11. So what are you recommending parents consider about this?
Well, again, all treatments, vaccines or other medical treatments, should undergo a very thoughtful risk-benefit calculation. And that means taking into account the risk that an individual has from the particular disease or illness, in this case, COVID, and weigh that against the potential risks and benefits of the treatment, in this case, the vaccine. Children, and we have known this from the very beginning of this pandemic, well over a year and a half now, have a de minimis risk from COVID, particularly children in that 5 to 11 age range. The CDC itself is only willing to acknowledge a total of 100 deaths from COVID in that age range, and it's deaths with COVID, not necessarily from COVID. Those children all had significant underlying health conditions, including diabetes and cancers and morbid obesity. Yet out of the 28 million 5 to 11-year-olds in the United States, there have been a total of 100 deaths since the beginning of the pandemic. So the risk in that risk-benefit calculation is almost zero for children. And then again, you have to weigh it against the potential risks of the vaccine. And as I said, we simply don't know. There is no way to answer what are the potential side effects, what are the potential impacts on fertility, autoimmune diseases, neurologic development, and on, cardiac complications, which we've seen in worrisome numbers in that adolescent age range. So we don't know yet what the impact will be in the 5 to 11-year-olds.
We had a doctor on from Rady Children's Hospital, and he said 94 young children have died in the U.S. as a result of COVID. You just addressed this briefly. Expand on it, if you would, because we throw that term around a little too loosely as far as dying from COVID. That would be like an elderly person who breaks a hip and then gets the flu. Did they die from the broken hip, or did they die from the flu?
Precisely. So we know that children have been tested for COVID because they're in the hospital, but they're frequently in the hospital with something other than COVID. They might have been admitted, for example, with a complication from diabetes, or they might be in end stages of treatment for cancer, or they were children who were admitted for severe trauma and they tested positive for COVID. Unfortunately, because of the way that COVID deaths and even hospital admissions have been recorded from the beginning of this pandemic, we have wildly overestimated the actual deaths from COVID as opposed to with COVID. So it will take some time for us actually to sort through all of the data and come to the actual numbers. But I can say it certainly is less than 100. And when you consider, again, 28 million children in that 5 to 11 age range and less than 100 deaths over a 22-month period, you can really come to the conclusion that children, particularly healthy children, are at a risk as close as you could possibly say to zero. Dr. Marty Makary at Johns Hopkins looked at 48,000 cases of COVID in people under the age of 18 and found a mortality rate of 0. So I really cannot, in good conscience, recommend that parents go out and get these children vaccinated until we have more data on the vaccines themselves. I would want to know what is the 12-month, 24-month, 36-month safety data before I asked a child or asked a parent to have a child vaccinated when that child has essentially a 0 risk of significant illness. And on top of that, Ginger, we also know not only do kids not get COVID and become significantly ill, they're lousy vectors of it, meaning they simply don't spread it significantly to others around them, including parents or elderly grandparents or teachers. And we've known that for many, many months, well over a year, based on significant studies and evidence all around the world from places that didn't close their schools down, for example.
Yeah, certainly have seen those studies coming out. Before we let you go, I understand that the Pfizer and Moderna, that they're protected from lawsuits, from any side effects from their vaccine because the nation or the government is basically absorbing that. Is that accurate?
That's absolutely true. Parents and patients of any sort, adults or children, have absolutely 0 recourse legally should they have an adverse event from these vaccines. The vaccines at this point are not FDA approved. None of them, none of the vaccines available in the United States, including Pfizer, by the way, who did get FDA approval for its branded product, Comirnaty. Unfortunately, Comirnaty is not available at this point in the United States. So all of the vaccines, J&J, Moderna, and Pfizer, being given to people in the U.S. at any age are only being given under an emergency use authorization, and they have absolutely 0 liability. So should you suffer a tragic or unfortunate adverse event from one of these vaccines, there is unfortunately no legal recourse that can be sought.
Wow. All right. Always enlightening. And again, really appreciate your insight as a doctor. Good to talk with you tonight, Dr. Victory.
Thanks as always, Ginger.
Thank you. You got it.